Okay, now so we're gonna be starting with the facial bones. Now we're done with the skull, so we're gonna go over the facial bones. So the facial bones, those basically include everything from the face, nasal, oral, and orbital cavities. So going from superior, again from superior meaning from above to inferior meaning below, from lateral to medial, we have the zygomatic bones, which is again your cheekbones. We have two of your maxilla, which is your everything else below. And then we have the lacrimal bones, which are the bones that are located within the lacrimal gland, which is your tear gland. And then we have the nasal bones. Next, we have the vomer, inferior nasal concha. We did discuss the superior and middle nasal concha. And then we have the palatine bones, which basically form your rooftop of your mouth. And then last thing, we have the mandible, which is your jaw. So the zygomatic bone, your cheekbone is paired, meaning we have two of. So remember, they were connected to the temporal bone using the zygomatic process. So could be a little bit tricky because the zygomatic bone is connected to the temples or the temporal bone using the temporal process. So this is an extension on the lateral side that connects with the temporal bone. So this is the tricky part. The temporal process is present on the zygomatic bone and it connects to the temporal bone. And the temporal bone has the zygomatic process, which connects to the zygomatic bone. So it's kind of tricky where each bone is located and where each process is located. But you can think of as zygomatic bone has the temporal process, and the temporal bone has the zygomatic process. Next, you have the maxilla. So again, the maxilla is this part over here. Again, we have two of, because there's a suture right here connecting both of them. So if you remember those two holes over here above the eye, those were called the supraorbital foramen. So we have another two holes here, one here and one here. Those are called the infra, since they're below the orbit, infraorbital foramen. So those are holes found inferior to the orbit. Again, they allow for, most of the time when we have foramen, those allow for the passage of blood vessels and nerves. More specifically, uh, there's this nerve called the trigeminal nerve, which we're going to be covering at the last unit of this course when we're going to go over nerves. Trigeminal, meaning it goes through so meaning it goes through three different areas. So one of the areas that it goes through is the maxilla. So this infraorbital foramen, one of the trigeminal nerves, like one of the branches that it goes through the maxillary branch of the trigeminal nerve. Next, we have the lacrimal bones. Again, we have two of, because we have two eyes. So the lacrimal bone has a fossa. It's the fossa for the lacrimal sac. It's an opening to the lacrimal bone found anterior on the lacrimal bone, assists with the draining tears into the lacrimal sac. So your tears would drain into this lacrimal sac, and this basically is done through this fossa, which helps drain it, the tears into the lacrimal sac. Next, we have the nasal bones. Again, we have two of. Those form the bridge of the nose. They also have cartilage, so your nose is not just bone, it has bone and cartilage. So it also supports the cartilage that gives the shape. So this is made of cartilage, this is not made of bone. So it just gives shape and supports the cartilage that is present on your nose. And again, we have two of, so those form the bridge of the nose. Next, we have the vomer. The vomer is this yellow bone over here. So this is your vomer. This forms 1/3 of your nasal septum. So it forms the inferior 1/3 of your nasal septum, which divides the right and left nostrils. Vomer translates to plowshare because it looks like a plow, which people use it in farming. So that's why they say it looks like a plow, which again, vomer translates to plowshare. Next, we have the inferior nasal concha. If we remember from the ethmoid bone, which had the superior nasal concha and the middle nasal concha, we have the inferior nasal concha. It's part of the facial bones, which is right here. Again, it also increased the surface area of the nasal cavity to allow for more smells and odors to get in. Next, you have the palatine bones. Palatine bones, it basically is the roof of your mouth. So those are the bones that are contained in the roof of your mouth. They form the posterior 1/3 of the palate. They also help form the nasal cavity. So it's like those two bones here. So you have two of, and small portion of it because it kind of goes all the way to the top. So a small portion of it is part of the orbital cavity of the eye. So it helps, again, part of the orbital cavity of the nasal cavity, and it basically forms the roof of your mouth. Okay, next you have the mandible. Your mandible is your jaw. So we have the ramus. A ramus is an arm. So this branch over here, this is called the ramus, is the branch found on the lateral side of the mandible. And next you have the mandibular condyles. Again, condyles are where two bones intersect and meet. So those are like knobs found on the posterior. Again, posterior means at the back end of the ramus. And those articulate, meaning they meet with the mandibular fossa on the temporal bone. Because again, remember the temporal bone, we had the mandibular fossa. So those condyles stick to the temporal bones on this fossa. Next, we have the coronoid process. So this curve over here of the bone, this is called the coronoid process. So it's a pointed process. It's a pointy process found on the anterior end of the ramus. And then over here, we have another foramen. We have the mental foramen. Again, foramen most of the time allows for the passage of blood vessels and nerves. So those are holes found on the anterior surface, which allows for the passage of the mandibular branch of the trigeminal nerve. Again, mandibular meaning it basically, this nerve has control over the mandible, which is the trigeminal nerve. So it goes through this mental foramen over here. Next, we have the hyoid bone. Your hyoid bone looks like this. It's located on the inferior to the mandible, so it's below the mandible, and superior to the larynx. You have the larynx, which is your voice box. Your hyoid sits on top of it. It's the only bone in the body that's not articulated with any other bone. It's like free-floating bone, so it doesn't connect to any other bones, and it provides attachment to many muscles, which we're gonna go over when we go over the muscles. There are like 6 different muscles connected to this hyoid bone. Next, we're gonna go over the ribs and vertebra, and that would be all with our axial muscles after this.